Former President George W. Bush is recovering from heart surgery. A spokesman says he's doing well with no complications after a blockage was discovered in one of his arteries. Bush had a stent inserted into that artery this morning at a hospital in Dallas. The former president expected to leave the hospital tomorrow, should resume his normal daily schedule on Thursday. Now, the blockage was discovered during an annual physical examination, and doctors say the former president acted swiftly when he received the diagnosis. Joining us now is Dr. Warren Levy, a board-certified cardiologist and chief medical officer at Virginia Health. Thank you for coming in. So you were saying the best outcome out of this, obviously the president doing well, is public awareness that you should look for these types of things when you go to the doctor. Ask them to test you for them.
Absolutely, Brian. When someone in the news has a heart issue, it gives us the opportunity to talk about risk factors, to talk about getting to coronary disease before it gets to you. And ex-President Bush was a very healthy guy. He exercised a lot, but he did actually have a screening test while he was the president that did show some calcium in his coronary arteries. That's an indication of early disease. But anyone who carries any of the major risk factors, high cholesterol, high blood pressure, diabetes, a family history, or smoking, and you really shouldn't smoke, these are the folks who should be seeing their doctors regularly, screened for heart disease, because we need to intervene before it causes a heart attack or worse.
A lot of people, and I can hear it already, would ask the doctor, and so I'm asking you, will insurance pay for this?
Well, it's a funny question. If you're having symptoms, it will. And if you're not having symptoms, it might not. And that's really a political issue in this country. Yeah. Heart disease is the #1 killer of both men and women. More women die of heart disease every year than men. Yet we don't do any kind of routine screening for this disease like we do for other diseases. And that's a good point, and it's something we need to continue to talk about.
Yeah. Tell me about this stent. I guess is it coated in medicine as well, did I hear?
There are different kinds of stent. It's not surgery. Oh. There's no cutting, and he will go home the next day. It's sort of a metallic scaffold that helps to hold the artery open. There are bare metal stents, and there are stents that are called drug-eluting stents. They give off a medication that helps to prevent a reblockage process that can happen. And we decide what to use based on the anatomy. But what President Bush had is a very common procedure. We do lots of them every day. There's no pain, no discomfort. It takes 45 minutes, and he'll be home in 24 hours.
And quickly, in about 20 seconds or so, can you rattle off a couple of symptoms of a blocked artery?
Well, the classic symptoms would be pressure, heaviness, squeezing in the chest when you exert yourself, sweatiness, increased shortness of breath. Women have more atypical symptoms. They may just feel a little breathless or a little sweaty. If you have any symptoms that are coming on with exertion and going away with rest, talk to your doctor. It needs to be looked into.
Dr. William Levy, thank you for coming in tonight.
Thank you. Yep.
Gary.